My name is Michael Moore. I'm the chair of the Global Task Force on Immunization for the World Federation of Public Health Association. It's my pleasure to introduce Eduardo Pisani. Eduardo is the CEO of All.Can, a organisation, multi-stakeholder, non-profit organisation for improving cancer efficiency. And he has been familiar for over 30 years in advanced public policy discussions. So it's important to hear the perspective of somebody like Eduardo Pisani, who explains why it is that sustainable funding allocated to our health systems becomes absolutely critical in terms of long-term health and in terms of improving health outcomes. It's my pleasure now to introduce Eduardo Pisani.
Thank you very, very much indeed, Michael. Thank you for having me today. Good afternoon, good morning, good evening to all the participants. And I will definitely try to build on the presentations of the previous speakers. And I will try actually to perhaps look at these issues from a slightly different perspective, a slightly different angle, notwithstanding, obviously, the key question which we have in front of us, how to ensure that health systems can increasingly become sustainable, efficient, and that's actually one of the words that I would like to use. Is it a distant dream? Allow me to start from this, because as I was preparing for this discussion, I realized that actually, even in the course of this year, 2023, there have been numerous high-level discussions that have got to do with health financing. And just for the sake of the background, if you will, of the context of my considerations, I wanted to submit to your attention some references which have got to do with inspirational approaches, in my opinion, which make me somewhat optimistic in answering the question, is it a distant dream or not? The well-being economy has been already referred to by Vivian, and definitely this is a concept which covers inclusive growth, health equity at the heart of public, social, and business endeavors. This is really a sort of manifesto which I also take on personally in my own activities. It's clear that narrowing the health gap is not only a matter of social justice, but it is essential to build the trust, social cohesion, and economic resilience. I'm reading these quotes for the simple reason that I would like to demonstrate that the subject matter that we are addressing today has been, is, and should continue to remain very high on the radar of governments and civil society organizations and all stakeholders, actually. So the other concepts which have been expressed lately after the pandemic by the so-called Monti Commission essentially underscore the fact that there is no sustainable path forward without governments prioritizing health in their spending. This is something which has been demonstrated clearly by Michael a few minutes ago. My additional focus, which I will expand on in this conversation, is that we need also more efficient and equitable spending. And therefore, the question that Vivian was asking at the end of her considerations, how do we create value? That's really where I would like to get to. Finally, it's important also to bear in mind that this endeavor, this task, is something which clearly is on the government's duties and obligations, let alone budgets, but it is something which has to be inclusive and has to also attract the contribution of the private sector as well as of other non-governmental organizations. Now, a reference has been made also to the SDGs. Here I'm focusing and I'm thinking about SDG 3, which is the one, as you know, that focuses on health. And one thing that is fundamental to underscore in order to try and find solutions to the question we are addressing today, one element is that sustainability and health system performance are closely connected, And therefore, improving efficiency of a health systems organization, financing and delivery modalities would maximize value for money, minimize waste, and help future-proof the system to meet growing demands. These are actually aspects and considerations that have been elaborated over the past several years and are published. So again, I'm here quoting some of the outstanding work which has been carried out to date, but also concepts and directions, paths of work, which I think we should continue to build upon as practitioners. One other element of information has got to do with the so-called accelerator that has been put in place by several organizations, public organizations, in the context of the implementation of SDG 3. Now, I use the expression implementation for the sake of explaining that there is significant work ongoing. You will see on this map, particularly on the right-hand screen at the top, the fact that there has been an analysis on how to ensure that there is more money for health, more health for money, how to facilitate consensus building and knowledge sharing and innovative funding. All these elements are being assessed and further elaborated really as we speak. Now, efficiency. Efficiency is a concept which is clearly connected, as we said, to value. It is also connected to better health outcomes. And I disclose the fact that efficiency in cancer care is really the focus, and it is the core of the work of All.Can International, the organization that I represent. And this focus on inefficiency in cancer care in particular, which I would like to offer as a sort of case study to everybody, started from the assessment that was made both by the OECD and the WHO in recent years, whereby, according to the OECD, 20% of all health expenditure is wasted on ineffective or inefficient practices. And this would correspond to 2 years of life expectancy. Now, the WHO, with a broader global remit, looked at similar parameters and came up to the conclusion that in other regions of the world, waste in healthcare spending can reach 40% of the total health expenditure. So here we are talking about a critical element in a strategy towards sustainable funding for health. The other dimension which I alluded to, and which implies that beyond the government contribution and the government commitment to public health strategies and public health investments, there is also a growing public-private partnership model, which is also supporting or enabling even sustainable funding models. Here I have got a few examples. Allow me to start, just for the sake of, again, of the context, from a very recent statement. It's the private sector constituency statement, which was released a few months ago in light of UHC 2030 and the ongoing discussions regarding the achievement of SDG 3 again. And I think it is important to recognize that the private sector will and should integrate UHC principles into business, will continue to deliver innovations that should respond to the needs of all people, make these safe, affordable, accessible, and sustainable. And again, here I'm quoting, help strengthening the workforce, and moreover, here, to the point of our discussion today, contribute to the efforts to raise the finance available for UHC. Now, clearly, many would ask, okay, what does it mean from a practical perspective? From a practical perspective, there are myriads of examples, thankfully. I will mention 2 or 3, and then I will dig one level down and come to my conclusions. Examples are somewhat illustrated, on the right-hand side of this slide. Let me start with one initiative which is very dear to my heart, and it's called the City Cancer Challenge, better known as CCAN, which has got to do with improving cancer care, and it is a public-private partnership to the extent that through the facilitation of the CCAN Foundation, cities, local administrations, and other partners of different nature, whether it's the World Bank, whether it's the private sector, etc., they get together in order to define an action plan that is aimed at improving cancer control and cancer care in given parts of the world. Similar to this, and it's even a broader set of examples, there is an initiative known as Access Accelerated. All of these obviously is easily available on the internet, and Access Accelerated has its own focus, specific focus on sustainable funding for health programs. And within that category of activities, there are very telling and very impactful case studies and stories which you may want to refer to. Let me move on and draw to the conclusion of this talk. I was referring to cancer care in particular. I'm still using the efficiency, the value concept, well, value connected to efficiency, connected to better outcomes, as a concept that connects us with sustainable health systems and sustainable health funding. One thing which seems clear is that our health systems around the world will have to invest on data analytics capturing in order to become data-driven learning systems. This is also an expression which I really bring to your attention because it is part of the sustainability and of the efficient investments that could and should be made actually in all geographies, in all regions of the world, in my opinion. What gets measured gets done. And measuring interventions and the value of both policies as well as specific interventions, as I was saying, in any area, let's take as an example cancer care, would allow to consistently benchmark and improve efficiency, therefore achieving more value for the money invested. One of the recent projects, research projects that we have conducted, one has been already published with the University of Southampton in the UK. The next one will come up hopefully by the end of the year with the University of Amsterdam Medical School, has got to do with metrics, with efficiency metrics. And sorry, here is an example of what I mean by that. Efficiency metrics would de facto imply that there are certain parameters of reference that are applicable anywhere, can be measured routinely, and can translate across cancer types in this case. Examples are listed here: time to diagnosis, primary care, interval, patient experience, etc., etc. These 8 core metrics listed here were identified by or through the research as really being applicable and existing everywhere. And I will not dwell into the details, happy to discuss this further. Last but not least, implementing efficiency programs can be done in multiple ways in any part of the world. And really here I have extrapolated the most recent highlights in 2023, which have got to do with cancer care navigation in Australia, how to reduce diagnostic delays in different countries, and how, to Vivian's point, enhance screening and early detection, and enhance, frankly, prevention overall, which is part of the discussion and the work program that we undertake in different countries. So I'll spare these list of concrete examples, and I'm really done. These are all practical ways of improving efficiency and therefore reducing waste, and therefore contributing to the sustainability of health systems. What we need, and this is really my close, Michael, what we really need is effective political leadership together with collaborative input, insight from civil society organizations and the private sector. Thank you.